So the work that I'm doing in the Erasmus University Medical Centre is about pharmacogenetics, trying to use DNA analysis to optimize drug therapy. And the reason that we do that is that because we know that patients will react differently to drugs. Some patients may do well, but we have patients that will have side effects. And we know that also like 6 to 7% of hospitalizations is in fact due to adverse drug reactions. So patients getting drugs, getting medication and not responding in the right way in such a way that they end up in a hospital. So we found some articles in the beginning, like in 1998, that showed that we could use laboratory tests like DNA tests to guide drug therapy. And we have been trying to implement that, and it has been quite successful, going from a research setting up the tests, into clinical implementation. And currently we are performing like 25,000 tests per year at Erasmus MC alone, just to make sure that patients can have the right drug therapy. And also, in collaboration with the hospital pharmacist, it's now true that you can go with a kind of DNA passport for medication to any pharmacist in the Netherlands to get the drugs prescribed according to your DNA profile. So that's really what we want to achieve, to have better drug treatment for patients based on the knowledge that we have. The first step in how we went from the research to the clinical implementations was actually just providing the tests, setting up the tests, setting up the DNA test for just one gene at the moment, looking at the drugs that were metabolized by that gene and trying to find out the proper guidelines in there, how that should be dosed according to the DNA information. And from that, we expanded, like after doing like 2-3 years of research, we were offering this as a diagnostic test. We were talking to the different clinicians, involved them in the decision making, and from there doing several projects, research projects, showing in fact the translational value of having this. And by doing that, we saw that there was more and more interest growing there. So we set up like a bigger network in the Netherlands. We collaborated with the pharmacists, and we made sure that there were evidence-based guidelines. So in that way, we kind of built a network in the Netherlands. But then we went on from that, because also from a European level, there was a lot of interest how we were doing that in the Netherlands. So together with some colleagues, I founded in 2011 the European Society of Pharmacogenomics and Personalised Therapy, also with the aim to distribute the knowledge that we had and also to acquire knowledge from other countries about implementation of pharmacogenetics. And that has become a very big society. We have like 600-700 members. And indeed, the last congress that we had like just a couple of weeks ago in Rotterdam, were like 520 attendees there, all focusing on pharmacogenetics in the different clinical disciplines. So in cardiology, in oncology, in psychiatry, in pediatrics, many more. To have all these people together, you can really see what is the power of networking, everybody talking to each other, having new ideas. And currently we're seeing that the society is also helping to spread this knowledge, to do education, bring research groups together, and also help implementation in different countries.